Christmas, Bree.
Merry
Merry Christmas.
Christmas.
And
Merry Christmas, Chief.
all right, you guys take care. Have a good morning.
You too. And we are going to continue to stay in the Zoom room, and we're going to bring in public health spokesperson Janella Carrera. Good morning, Janella.
Hey, good morning, Bree. Good morning, Andy.
Good morning.
You know, when we had you on Monday, you said, oh, you guys are super busy, and you weren't kidding. Oh, my goodness. Yesterday, the arrival of the vaccines. So tell us about the plan, because we got the release last night about tomorrow. So what's happened since the arrival?
So since the arrival yesterday, we've just been in, I don't even know how best to put it, crazy mode. Yesterday we were from the airport to, Okudu High School, to bringing the vaccines to the freezers, just planning left and right. So, and meetings left and right. So we stored the vaccines properly and securely. Now we go into planning for administering the first doses of the vaccine. So of course we're moving into bringing that to Okudu High School tomorrow through closed pods or closed points of dispensing, and they're called pods. And we're also going to be distributing some of the vaccines to both GRMC and GMH, who will be dispensing or administering some of that to their own staff, who they've identified to fall under the phase 1 group. And those are, of course, their physicians and nurses. And then those who are not affiliated with GRMC or GMH, but are healthcare frontline workers, they'll be given the doses through public health. And so we kind of already have a list, because we've already worked with some of the private healthcare clinics to provide us a list of names that fall under that category. And so we'll put a call out to that phase 1 group that if they want to receive the first dose and they're in that list that we received, they can come to Okudu High School tomorrow to receive that first dose. So what'll happen is they'll come in, we'll match their names or IDs against the list that we have. And if their name is there, they can proceed on through. Our nurses and staff will give them that initial information, make sure that they understand, what they're receiving. We'll also give them some education as far as any potential side effects, make sure that they do qualify to receive this in case they might have some medical history, that any contraindications. And if all is clear, then they'll be taken to a room, the closed pod where they receive the shot. And then they'll be taken to another area where we'll have a nurse and a medic to monitor them for about 20 minutes, just to ensure that they don't have any reactions to the vaccine. And if all clear is given, they don't have any reactions, then they can go ahead and proceed on home. But of course, we'll also inform them to look out for any other reactions after they leave. And if they do, to call a healthcare professional, or just to go ahead and proceed to the emergency room, just in case it develops at a later time.
How many?
So, Janella,
So that's kind of in a gist what the.
Okay.
Go ahead,
So
sorry.
for the first couple phases, these are already spoken for. You have the list. This is not, the general public can just go line up and like, oh, I'm going to wait and see, first come, first serve. These are already spoken for. Take care of those first responders, and then the at-risk healthcare workers. And then when you get the other shipments, then the public can start getting them, correct?
So the phase 1, you're right. They're somewhat spoken for, because they've already been identified through GMH, GRMC, and then we're developing. We already have a list, but we're continuing to develop that, working with private clinics. We'll work with, as you were talking with GPD Chief Steve Ignacio. We'll be working with GFD as well for medics and EMS personnel. So we'll continue to develop that list that fall under the phase 1 category. And then as we continue to receive doses of the vaccine, we'll continue on with the phase 2 category. And those are people who probably didn't receive the doses under phase 1, so the remainder of phase 1. Also those who with high-risk medical conditions. So those will probably be identified through, for example, their doctors. So they'll probably receive some kind of, they'll work with their private physician to identify what those medical conditions are that qualify under phase 2. So if they have comorbidities like diabetes, heart disease, lung disease, and then we'll also identify them based on age. So if you're over the age of 5, that'll be, you'll fall under category phase 2. But for the general public, any of those subgroups, that'll be defined by the vaccine committee. But before we even get to the large public or even the subcategories, most of it has already been largely, we follow the recommendations by the ACIP and the CDC. So they've already sort of been pre-established by the federal government and those federal guidelines. So we follow that. But subcategories, anything beyond that, we'll work with the local vaccine committee, and they'll help us define any subgroups moving forward.
Mm-hmm. Is it just healthcare workers scheduled for tomorrow?
It's primarily healthcare workers. We also, I believe we also, I'm not sure if we already have the list for EMS workers like medics, firefighters. And I think for GPD, I think Chief Ignacio is still putting that list together. But for the most part, we have a list that's through public health. And then I believe for GMH and for GRMC, they already have their list of their staff and frontline workers they're going to be giving the doses to.
How many people are expected to be vaccinated tomorrow?
I believe through GMH, I'm not sure the number for GRMs, but I was briefed for GMH. I don't think we're going to get all of them in one day. So this is probably going to be like a multiple day operation. So I know GMH had surveyed their staff, and I think it was about, actually, no, I'm sorry. So it was GMH and GRMC combined. It was about 1,600 of their staff combined. I don't know what the breakdown of that is. I don't know if it's 800 one hospital, the other hospital, and I don't want to guess. But when they surveyed about 1,600, GMH, for GMH, it was about 70 to 72% of their staff had expressed interest in receiving the vaccine. But as far as the breakdown, how many staff at one hospital versus the other, I don't know. So. But I know it was a combined 1,600 for both hospitals.
So what happens after they leave Ukadu, after taking the vaccine? What kind of monitoring, I guess, goes into effect? And how do you track, all these people that are taking the vaccine?
So that's what we're working on. Of course, we have their phone numbers, their contact information, ask for their addresses. And, when it's time for their next dose, of course, we let them know that they have a second dose 21 days later. And to be expecting a phone call, whether it be a phone call, a text message, an email, and that's how we'll be contacting them. In the future, though, and this is something that we're also working on as a department, we're looking at technology as a way to build that into our system, and not to replace, this contact, traditional way of contacting and communicating with people, where you actually do a phone call, because that will still be, I think, the primary way of people is through phone call. But in addition to actually picking up that phone and talking to an individual and saying, hey, you know, your appointment is coming up, your next dose is coming up, please come on this date to get your second dose. But just to augment, you know, our efforts to make contact and remind people about a second dose. But we are looking into adopting digital technology to use as a way to remind people. And it could be something like, you know, it'll be, it's 15 days till your next dose, 14 days remaining till your next second dose, 10 days remaining till your next dose. Don't forget, tomorrow you're due for your next dose, something like that, a daily alert that you can get through your phone or a text message. That way people will never forget. You know, it could be annoying, but at least you know your next dose is coming up.
What happens? Because do we have an idea when the next shipment of Pfizer is arriving? It would have to be within the 3 weeks,
So,
right?
right, it would have to be within the 21 days. So I believe I have to check with Annette, but we were given the green light a couple days ago to go ahead and place our second order within 24 to 48 hours. So that would have been by today, to place our second order of 3,900 doses. So if we had already placed our order by today, then we would anticipate our second arrival or our second shipment within another 3 to 5 days.
Right.
And if all goes like our first order, it could be any day now as well, because you know we were thinking we wouldn't receive our first order by the end of this week. Well, we received it within 2 days. So
So Janella, we have the governor